Hi, everyone. Good morning. Thanks so much for taking the time to join. I know as we go through the days of ASU+GSV, the ability to sit in conference rooms dwindles, but this is a pretty exciting panel. And even though there's only a few of us in the room, I'm still going to ask you to do something for me. Stand up if you have ever used a healthcare service before. Stand up if you've used a healthcare service before.
We have.
Okay. Sit down if you have never engaged with a nurse or an allied health professional in that setting. We're all still standing.
It worked.
So, it worked. I had a feeling. You can have a seat. When we talk about mitigating the healthcare crisis, we are not just talking about a niche in one specific field of academia or learning or anything like that. We're truly talking about addressing a shortage that affects every single one of us as human beings. And so I'm so excited to have this panel with us today as we think about ways that we can really mitigate the crisis that we're seeing in the healthcare space. And so I'm going to have everyone just quickly introduce yourself and your organization. Let's just go on down and say who you are and kind of a quick blurb about your org or your institution.
Sure. Thanks, Lisa. I'm Patty Knecht, and I'm the Chief Nursing Officer at Ascend Learning ATI Nursing. And although we serve many different healthcare markets, one of our particular focuses is on nursing, and we prepare our students from the day they enter the program to be well prepared for their NCLEX exam, but also be safe, effective healthcare practitioners. And then we have also many other entities that work all across allied health.
Hi, I'm Jennifer Graebe. I'm the Director of Nursing Continuing Professional Development and Joint Accreditation at the American Nurses Credentialing Center. And we accredit organizations that provide professional development to nurses, but also interprofessional CE. And that joint accreditation is a partnership between medicine, nursing, and pharmacy, but we also have 10 other associate healthcare members. So although we function primarily in the practice space, professional development space, we very much influence the conversation around how learning never stops and how learning can be leveraged to address not only the nursing shortage, but also to create pathways into nursing or other healthcare professions.
Awesome, thank you.
I'm Natalie Jones. I'm the Executive Director of Workforce Development at Wellstar Health System, a large healthcare system in the state of Georgia. And I support our academic partnerships, our nurse residency program, our specialty fellowships, and really have worked through the pandemic to create those pathways. That's where we've started a lot of that work for nursing support roles and have begun the work in allied health.
Hi, everybody. My name is Charla Long. I serve as the president of the Competency-Based Education Network. We work with universities and community colleges and colleges of applied technology to help build out nursing programs that are based on the competencies nurses need and not so much the amount of time it takes to get there.
Awesome. Thank you all. So we keep hearing some pretty big and disturbing numbers in terms of the healthcare crisis. And so just want to highlight that we've heard that there's over 1 million nurses that are needed. We know that there's about 500,000 nurses who are set to retire in 2022. Simultaneously at Guild, we did some research where we interviewed some of our frontline workers across multiple industries, and 70% said they would be interested in careers in healthcare, but they didn't really know how to get started. They weren't quite sure what that could look like, but there was a real deep desire to learn more and to be able to help people and give back in some way. And so when we know that there's this tension between a shortage, but there's also still desire, would love to just kick off and ask each of you, and we can go straight down the line here. Share a few sentences about why you think we have the healthcare shortage. Where is the system broken? Where are the challenges that you're seeing in us really addressing and mitigating this need?
Sure, I'd be happy to start. So, I think that there is not always clear understanding of all the different opportunities in healthcare. And I think it causes confusion. And so when students are looking for pathways or adults are looking for new opportunities, we come with this alphabet soup of how you can enter healthcare. And so that causes an awful lot of confusion in their mind, coupled with the fact that there's not anyone out there, particularly with adults, which we're focusing on in this discussion today, to help them understand what's the rigor, what's the academic rigor in each one of these pathways, what does it look like? And then most importantly, we have not, as an industry, done what I would call a above average or certainly not excellent job of creating seamless pathways. We've worked it, we've tried. We have many different entities who come together. To my friend, colleague down here who talked about competency-based education, nursing in particular has for a lifetime been trying to come together and say, what exactly are those competencies? And let's all agree on them. Let's all nationally say this is what it is, and let's move forward. And so that's caused us some of this pause over the years. We have many companies like ours who are working with a multitude of nursing schools and educational entities where we are trying to help frame that and move that forward. So I'll stop there to have my colleagues continue.
Thank you. I think there are so many, but in order to remain succinct, I believe one of the major there's barriers. That's, I think, high level. And one of the major barriers is that we continue to focus on healthcare, academic programs and pathways and pipelines into healthcare to be considered very traditional. And one of the things that we have to look at is if we want to diversify healthcare, we have to be really humanistic about the journeys that different humans go through and provide those on and off ramps in terms of opportunity to become educated and advance themselves into different professions. So I think that is one of the really big opportunities, but it's also a large barrier that remains prevalent. Mm-hmm.
Absolutely. Natalie?
On the industry side, we certainly think about competencies, but we also have an opportunity to be at the table more with our academic partners, really thinking about the supply and demand issues, thinking about workforce planning, being able to be a lot more predictive. Some of these models are viewed as being expensive sometimes, but having a hire ahead model in which you could have a pathway where if you hire this person today in a nursing support role or in an allied health support role, it may be the professional of tomorrow. So being able to be a lot more broader in our thinking and how do you stack those credentials and build what they're learning in that support role that could potentially impact their career trajectory in years to come.
Yeah, I want to answer this question, but I want to say one thing on that is I think AACN's The Essentials that have come out that say these are the nursing competencies for baccalaureate programs and for advanced nursing programs, that's a start. But it doesn't help you with your pipeline problem, right? I said pipeline like I was from the South. Sorry about that. Every once in a while, my accent comes out, and I just heard that go, wow, that was a Southern draw. I work hard to hide that most of the time, but that one just snuck right out there. But it doesn't help our pipeline because that's really focused on baccalaureate. I need to think about those early career folks that are maybe in a different area in my hospital, but they have the propensity with some training to move into early nursing related careers and then into that pipeline. So I would say it's a good start in getting a language. The thing I wanted to answer on this question is we've got to think about time does not equate to competence. And we look at nursing boards, licensure bodies throughout the country. You have X number of hours of continuing ed. I could care less how many hours you spent in continuing ed. What I really care about is can you do your job better? Do you have the competencies that are new, cutting edge that I need? Sorry.
Can I just
Please.
dovetail off of that real
You
quick?
may.
So I think both Natalie and Charla began to answer what I identified as a major barrier. And one of the opportunities is leveraging professional development for it to mean something other than time in the seat. What is that certified nursing assistant able to articulate in terms of competency, show in a sim-like setting, and then even apply in the practice setting that has similarities in relationship to nursing-related competencies and start to leverage that as prior learning assessment?
If I could just add for a minute too. So, the risk that my nurse educator colleagues would respond with, would they be like, well, we've got this over-looming big exam, and if I take some risk, I'm going to have trouble on the outcome end. So to my colleagues' points,
Sorry, you won't have trouble on the outcomes ends. I can ensure the outcomes. Boy, that would be difficult, wouldn't it?
So you got it. So to articulate the point, I applaud AACN with the essentials and the competencies because we've got a great starting point. What I think also becomes critical is we've got to re-engineer the way in which our nurse educators think and the way in which they approach education. And they've got to think competency first. And the essentials will help us get there right now because it will start at that baccalaureate level, and it will continue to be infused throughout the pathway. So I think we're headed in this tremendous new first step, but we've got educators on the edge, I would call it, who are feeling the stress of not only essentials, but also next gen and clinical judgment, whole story for another day. And we've got to be sure they feel like they've got a firm foundation to build on. And that's what's going to get us to where we need to be.
Absolutely. And I think just building off of the idea of like the competencies, at Guild, at least we're pretty intent on creating stackable pathways and be able to really use competencies and that kind of framework to empower that kind of on-ramp. And a question I have is like, as we think about these kind of modular on and off ramp stackable pathways where learning can kind of be broken down in new ways, Jennifer, you talked about the integration kind of professional development with learning and it not being siloed. Can you just kind of kick us off? Tell us a little bit more about that. What can that look like in practice for academic partners, but also for on the employer side too? Natalie, would love your perspective on how that could work.
Sure. So I think when you look at professional development, there are a couple key components that are critically important to think about, and that is how is the professional development designed, implemented, and evaluated. And so similarly to academic programs, you would want to ensure that there are guardrails and frameworks that are used to make sure that it's based on the best available evidence, that there isn't bias and influence from industry like device and pharma, but most importantly, that it's outcomes driven. And so we use a backward planning approach that is outcomes driven. One of the other things that we have at the ANCC is an outcomes-based leveling methodology that is very much rooted in the CBE methodology, where learners are actually identifying what their outcomes are, and then the nurse planner, the nurse educator, or professional development practitioner is really a facilitator of that learning, and it can be individualized for a specific nurse or a team in which they work. And so how can people use that? How can the nurse use that? How can a hospital system use that, or an academic institution? I have ideas there, but it does require a challenge and disruption of the status quo. When an academic institution looks at accredited continuing education, and again, I use that very purposefully, they should have a sense of trust that that education was designed based on similar standards to curriculum design in the academic setting. And when those activities are aligned to practice competencies, whether they're baccalaureate, AACN essential competencies, or even advanced practice competencies, those competencies are very much integrated and rooted in the practice setting. So how can we align that work so that nurses don't have to sit through, or even our allied health team professionals, and I'll call out to the world that we need to challenge what that term means and have a better integration of other team members within our profession, right? So we can avoid reteaching what they already know, can show, and or can do. And that will help create more seamless, engaged pipelines by using professional development for prior learning assessment.
I love that.
I hope someone recorded that, because that was great.
I love it. I love it.
Humbly said.
A humble brag on behalf of Jennifer. Natalie, earlier over breakfast this morning, you kind of shared some of the things you're all doing from the employer perspective to really integrate practice and what's happening at a site and expand some of these pathways. Can you share some of the examples of what this looks like for you at Wellstar?
Yes, I was thinking about Jennifer was saying, and that definitely was very profound. One of the things that we've thought about very recently is how do we automate that? You know, when I oversee our nurse residency program, and we've challenged ourselves to make sure that we're not repeating what they've already learned in nursing school. So what if in an ideal world, we had a system in which we could evaluate competencies when they're doing their senior practicum. And if they're employed with us, we just continue that entire process so that we're not starting over once they've become an official RN, but that we're really continuing to build upon that, shortening their onboarding time periods, and also their orientation. You know, there you have that ROI. When we think about the CNA and CMA pathways, though, it's the same concept. Would we indeed need to start over just because you are becoming an RN if you've been a CNA or a CMA and you've already gotten a lot of the, building rapport with the patient, or, things like that, that safety, those things that although you've now got a different role, we can focus on the how you do it, the policies, and really not start a competency over. So how do we document that? We have began some of the automation, of course, during COVID. We learned quite a bit about how much we had on paper. So we moved quite a bit into our electronic system so that we could pull out competencies. And not only did that allow us to know where people were with competencies, but where are our highly trained nurses in the system so that we could know who could take care of a patient that was on an ECMO or something that was significant where you needed a highly skilled person.
I saw Charla ready to jump out of her seat over.
Well, no, I was going to
Please
say,
go ahead, Charla.
I think it starts by thinking of those competencies and putting them on a level of mastery. What does that look like when I'm a personal care aide? What does that look like, that same competency as a CNA? What does that look like at this level and this level that then connect to the AACN levels, right? When we can do that, we help them to say, see, you're here, but look, if you could develop to this, that gets you to this place on the pipeline. I think that's the benefit of competencies. If we lay that level of mastery framework down and build them all the way through. In the state of Tennessee, do you mind if I know
Please.
it's on your question list, but in the state of Tennessee, we have built a competency-based program that's really for personal care aides and CNAs. It's based on competencies that now community colleges are embedding into entry-level nursing credentials to say it's a step. If you go through this work-based training, you get the badge or the credential for that competency at that level. That's going to embed into our nursing, which we're going to take you then to level 3, and then we're going to be able to pull you to level 4. So I think it can be done, and I think competencies is the key, obviously.
So I have a couple thoughts to add. One is the critical importance of assessment.
That's right. Absolutely.
That's right.
So, where do we have those national norm tests or local norm tests, whatever might be applicable in a particular pathway area, that ensure that, yes, learning did occur, and yes, achievement did happen, so that when they go to the next pathway, they're set up for success. If not, we immediately really decrease their confidence level, and their ability to move forward on that pathway looks a little different. Back to Jennifer's comment about these stackable potential professional development credits. Yesterday's AACN announcement spoke to the decrease in MSN degrees that are happening right now in the last year. And that, of course, is a big yellow flag for myself in terms of the amount of nurse educators we need to avert this shortage. So I think quickly to Jennifer's analogy, if we were able to identify and work well with our partner institutions on what are these competencies, and we were able to work with an academic partner then, which is currently happening in some places, but not enough to say, yep, you can have some credits, because we're not going to be able to, in the short term, in this shortage, change that credit is currently the process that occurs to get an MSN degree. It's just not going to happen to get us out of this crisis. So how do we work around that we've got one group over here thinking A and another group over here thinking B? I think right here we have a good answer that could really propel us in a good direction.
Love that. And as we think,
I was just going to say too, I think the assessment, competency assessment is such a critical component of CBE. And outcomes-based CE, which is our professional development model stemming from CBE. One of the things there is that when we look at the gamut of learners, to make sure that we're assessing the competency at the level of need that's identified, and that there are multiple ways that that can happen, but they must be evidence-based. So if you're testing practice, you certainly would not want to use a test to test practice. You might need to use direct observation. If you're assessing skill, you can use a skill-like setting, case-based scenarios where the learner is applying the knowledge in suto. But if the expectation is that they then apply that skill-based learning, it must then have an opportunity to be assessed for competency in the practice setting. So I think that's critically important, and a really good thing that you brought up in terms of the assessment, that it is not a one-size-fits-all, and it needs to be tailored to where the what outcome you're hoping to achieve, but where the underlying need or needs are for that learner or group of learners.
Totally agree.
Yeah, and I think,
If I could just say one more thing about screen-based simulation and analytics aligned with it are just, and it again clearly gives us that pathway of ed tech now aligned with the traditional model can get us to the next step in the interim till we get full
Patty,
force.
you're actually hitting on the question I had, which is as we think about like the role that tech can play in this space, because this cannot be manual one-to-one processes that will get us there. Can you talk a little bit about kind of the opportunities you see for technology to help advance this work?
Sure. So I'm going to say I have a framed two different areas in my mind. If I'm speaking, and I'm going to speak for a moment directly to nurse educators, since that's what I probably really know best. To my point just earlier made, screen-based simulation and assessment is a key element. So you're going to immerse them in this competency, in this learning environment. You can use different modalities. In the end of the day, we want to make sure that learning occurred. And I agree with my colleague, test isn't always going to be the right answer. So we have other modalities we can use there, and I think that's a good example. The other piece, though, that in a very broad sense, when I talked about nurse educators on the edge or healthcare on the edge, the dynamics are very strong right now in terms of the fiscal crisis in our schools and universities. We're hearing it every day. And so how can we be sure that that educator who's in a shortage situation is focused on exactly what they need to be focused on every day? So I also think that there are tools, administrative tools. One comes to mind for me, it's called Program Manager, where it's able to help the educator to efficiently do scheduling, very efficiently do compliance, agreements with your institutions, but then take it a step further. How do you map your curriculum? How do you ensure that you're aligned for accreditation? That bogs our educators down dramatically, not the thought process, but the mechanics of that Excel spreadsheet that's 16 miles long and those stacks of things when you show up for an accreditation visit that they have worked through and tried to prepare. So administrative tools are huge answers right now as we zero in on, we have a shortage, how do we use that person most effectively?
Absolutely. Charla, I know you mentioned some of the badging work and things that are happening in the state of Tennessee. Can you speak to some of the tech tools or other opportunities you see in this space?
Yeah, I mean, thinking through performance-based assessment, right? I want a nurse who knows how to get that catheter in or knows how to put an IV in. I don't need them to practice. I don't want them to practice on me. Get me somebody. I remember having a baby, and they were like, this is my first time. I was like, no. Go get me somebody who's done this before. I don't want to be the practice candidate, right? And so really thinking about what our simulation experiences look like. How do we make those cost effective? How do we make those available in communities that need those simulation activities, those tools in their community or around the world to train folks in a more effective way? I think that's one place. Any place we can connect what's happening in the workplace to what's happening in higher ed. How can we share that learning record? How do we package up what you're giving them, which is absolutely essential, use a language we both understand, higher ed and you, package that up so that we can empower that learner to move faster in the official credentialing process. I think any of those technologies are really helpful.
That's great. Natalie, from the employer perspective, are there tools or technologies that you use or that you wish existed that could make this a little bit easier?
You know, I think Charla referenced quite a bit the learning management systems that we used, again, during COVID. We recognized that there were just some opportunities to optimize them. How can we put our hands on transcripts to evaluate the number of hours that they had in a certain area? We did, right before the pandemic hit, look very closely at the Donna Wright model, and I'm hearing a little bit of those tones here as you think about how competency is measured and how are you more efficient so that you're not always testing people or having them to do these big skills days where they're repeating the same information year after year, but that they're building on competency. So how do we automate that has been a huge focus for our healthcare system. I believe we're still on that journey. But over the last 18 months, we've been able to streamline so that we don't have people repeating the same competencies year after year that become redundant.
That's great. That's great. As we think about this desire for acknowledging the learning that's happened, the competencies, you mentioned credit for prior learning, which we sometimes call credit for X, right? The ability to actually say that like your lived experience as maybe a CNA actually can count towards something else. I have two questions, and I think one is, Jennifer, I want to start with you, is like, are there any, what are the policy implications here? What are the accreditation implications around like stackability, competency-based? Is there anything that needs to shift, or what promising shifts are you seeing that will help us get to this and realizing this possibility?
Yeah, I think that's a great question.
Thank you.
And I will say off the top of my head, I am not aware of any policy implications for this. I do think that there are policy implications that have unintended impact that will impact this. So for example, during the pandemic, many state boards of nursing waived continuing education. Why during a global pandemic is the learning of the nurse no longer a priority? That is likely, and I say this so respectfully, I hope I don't get in trouble, but why is learning equated to the number of hours a nurse spent learning rather than what their gaps were and how they closed those gaps either as an individual or a member of a team? So I think from that aspect, we look at learning as a barrier because of the time that's equated to it. And I think competency-based education and what we have really focused on in the professional development space, and particularly as an accreditor, is to start to shift that conversation that we need to recognize learning where it's happening and leverage it, and also get nurses and other members of the team that are engaging in our accredited CE to be able to articulate what that learning meant. This is what this certificate of completion means to me, and this is what I can now know, that I can tell you I know, can show and or do as a result of engaging in this. So to kind of wrap up my answer is there are no policy or regulatory implications that I am aware of. However, we need to be really cautious that we don't create policy and regulations that will negatively impact a movement like this.
That's great. That's great. When we think about...
I hope you wrote that down too.
I did not, but you're on fire. We love it. We love it.
Meow.
As we think about, so if there's not a policy barrier and there's not an accreditation barrier, and we feel like this can be a reality, we still have education deserts, right? We still have places where people have difficulty accessing maybe the lab component, have difficulty accessing enough clinical sites, or they're left to themselves to go find a placement. In that space where we don't have the regulatory accrediting, but we also have these like kind of spaces where it's really hard to navigate that, what strategies are you all seeing that are really working and are most impactful there?
I'd love to take that one real
Please
quick.
do.
We have a number of schools in Texas right now that are building and rebuilding their nursing programs, and they're not doing it alone. They're bringing in their hospital partners, and we're saying, all right, the classroom is not our campus. classroom is your campus. Right. And how can I use your campus and experiences on the job, and how can I assess those and allow that to work? So they're building or rebuilding their nursing programs and partnerships with their hospitals, their long-term care companies, their post-acute care companies, and they're saying together, how do we create the programs we need for the healthcare professionals? And we're both teaching in that journey. We're both assessing and validating learning. And I'm not so bound to the number of hours I have or what I have for an opportunity, because you've got a lot more resources than that institution's ever going to have. Right. If I'll just partner with you and together we collaboratively work on a solution.
Go ahead.
That's all right.
Okay, I was just quickly, I think also this is a really ripe time for organizations that are resource rich to really think about extending their capillaries out to facilities or organizations that are not, and creating those partnerships. Because if you have large organizations that are able to do this and then smaller ones who are not, it does create, it does have another adverse impact, so.
That's right. Yeah.
I'd like to revisit just for a minute the regulatory piece and the accreditation piece. I would say that my view would be that there's not, as my colleague articulated, necessarily anyone saying you can't go there. But there is a very strong presence in a nursing school that you're going to go on provisional if that NCLEX pass rate decreases under a certain level. What that creates is a resistance to change. Mm-hmm. There is evidence that there are schools who have gone through a curriculum redesign that the end result is hugely beneficial, but an interim year or two might not have trended in the right direction. And thus, there are our clients and other of my colleagues who are like, whoa, we're in a really tough time right now. We just came out of COVID and NCLEX pass rates are low across the country. Mm-hmm. We have both PN and AD that are below 80% as a national average last year. Baccalaureate a little bit higher. So there are many of our clients, my colleagues, who are on provisional status at State Board of Nursing. That creates a lot of extra burden and work.
Right. Absolutely.
So I don't
Maybe we could think about a performance-based NCLEX instead of a multiple choice test, right?
I agree, Charla, but
that's exactly what I was going to say. Is the AACN Essentials have totally disrupted how the academic setting is going to teach. The NCLEX, again, respectfully, may not be the marker that we need to look at if it's a test-based, knowledge-based test, if the competencies have to be achieved.
So I don't disagree. Mm-hmm. What I'm articulating is the reality of now.
Yeah, that's right.
And that we have schools coming off of a very difficult time. And so there are educators who want to embrace this. We have those deep conversations. They want to move in this direction, but they have regulatory and accreditation concerns for which could shut their school down.
Absolutely.
And so they have to be careful. That's all.
Totally
we have to be careful.
Patty, and I think that on the industry side, many of our healthcare systems in our state and beyond stopped clinicals completely. There was a downstream effect from the time that COVID hit where hospitals said we can't bring students in anymore. And so we've got to partner in terms of the supply and demand of clinical placements, joint appointmentships. All of this stuff is in the National Councils of State Boards of Nursing reports. What's missing many times is that we're doing it in silos where we've got the colleges doing it, sitting at a table, and then we've got the academic partners and the healthcare industry partners sitting within their organization at a table. But when we can bring them together,
that's right,
it makes all the difference in the world. And so we didn't stop clinicals. So our NCLEX pass rates with the partners that we are in relationship with, we feel like our students have done extremely well. Those that chose Wellstar and were externs, giving them credit towards their academic preparation during COVID. All of those things were outlined in that National Councils of State Boards of Nursing report. But what we found is that many of the schools, to your point, had so much concern and anxiety about how do I keep my NCLEX scores at a certain level that they didn't take action on some of the things that are within that report.
I agree.
Yeah.
So we have a core issue of what is that end outcome?
Absolutely.
How do we get to safe care? And as importantly, back to some of our conversation about stackability and I guess I'll call it increased awareness of why professional development is so important and isn't one of the first cuts, is we need to tie that to the ROIs at the provider side. We need to make sure it's around quality outcomes. We need to make sure it's around that, you know, they did not get reimbursement for these areas. Why did that occur? What is that learning need? Then we get that buy-in that looks a little different. But it's tough. It's a tough road.
That's right.
It's not an easy road.
Speaking of it being a tough road, we are 4 minutes, so we have 4 minutes left, and I'm going to ask each of you to take 1 minute of time to answer this question. What is, from your perspective, the one thing that either your organization or other organizations, if you prefer, can do to actually increase access to healthcare pathways while maintaining quality outcomes? And Charla, I'll start with you.
Well, I'd like to say I have 51, 50, 40. I was just trying to a little time. I think it is helping institutions bring employer partners to the table, and also the field in a broader degree to set those levels of mastery around what that looks like so that we can continue to pull people up the healthcare pipeline. Institutions, quite honestly, struggle to do that. And I do think our employer partners have that knowledge. And so creating space for them to collectively work on that, that's an area that we're really focusing on as we try to redesign programs to be competency-based in partnership with employers.
Great.
I gave you 6 seconds.
Oh, wow. Thank you. So, you know, I think it's getting started. You know, many people run from this work. I've heard it throughout the conference this week is, you know, where do I get started from a workforce development standpoint? We didn't start with a CNA program. I mean, we started with just looking at our existing partnerships and placements. So having those conversations, building on those relationships, but just starting with something very simple can have a huge, huge impact.
That's great.
Oh, wow, you gave me a lot of extra time. Look at this. I think from my perspective, where the ANCC fits here is to continue to role model and influence the future. We are in the business of being having foresight and in some ways dialoguing with disruption. We did that with our outcomes-based CE model in 2015. We were engaging in competency-based education when it was really not a topic of conversation in the professional practice space, and that time in the seat was the equation to learning, not what people actually learned. So I think that's our role, and also to be the conduit to have the conversations about building relationships and connecting people and supporting the future, and not finding a way to not do that, I think is really where our footing is.
So to wrap this up, I guess I would say from an Ascend Learning and ATI perspective, we take very seriously the responsibility we have with our partners to help them understand how to create these relationships. What's their next step? And you know, one of our conversations that's been quite robust lately is that the students are not ready for the rigor of nursing school, and it's been complicated by COVID. And so we are very strategically looking at how can we help on that front end. How can we improve access through ed tech that will support being able to be proficient on your prerequisites? Because if you can't get through your prerequisites and you don't have basic reading and math skills, you will not make it in either an LPN or an RN program. And so as we bring them through the pathway, we've got to make sure that's where it needs to be.
Awesome. To all of our panelists, thank you so much for your passion for driving the future forward and helping us address this crisis. Thanks for your perspective, and thank you all for joining. Thank you.
Thanks, Lisa.